everyone. I'm Dr. Paul Stricker, and excited to share with you about resistance training for children and teenagers. So disclosure, in the past 12 months, I've been a paid health advisory board consultant with the Juice Plus company, and I will not be discussing any unapproved or off-label devices today. So when we think about this wonderful topic of resistance training for our youth, it's important for us to think about where have we been, what is happening, what have we learned, and where are we headed? Because a lot has changed. And fortunately, I've just had the great pleasure and honor of being involved in this topic with the AAP for many years and through many different statements that have come along. And so it gives me great pleasure that we were working also on the most recent clinical report. And so I have that reference for you here for you to use, because it is definitely very different than any of our previous statements or reports. Why is there an increased interest in resistance training? Part of it is just the natural effect of increased youth in our sports, but also some interesting things over the past decade. There's been studies in the United States, the UK, and the Czech Republic that have shown that there has been actually a decline in the muscular fitness of our youth. And so it's kind of surprising. And then we all know that in general, there's always increased health problems associated with inactivity, but certainly we have learned that even more during this recent year of pandemic. So where have we been? We've been to a lot of places in this topic of resistance training, many of which used to be associated with a lot of fear. There was a lot of fear associated with resistance training because I think people's immediate visual picture that came to their mind was having a young child lifting heavy weights, and that just did not seem to be a situation that was appropriate. So there was a lot of myths and a lot of concerns that were created out of those scenarios. But fortunately, we've had decades of really, really good sound research that has proven over and over again that young children can gain statistically significant strength with a very low risk of injury. And so after years of those studies, finally we've been able to say, okay, great, we have proven that they can get stronger. But now let's start looking at research that shows what can we do with that strength and what benefits does it provide, which is now becoming a very exciting part of this topic. So yes, that was outdated from 2008, so we have updated with the clinical report of 2020. Well, there's, like I said, a lot of fear was surrounding the whole aspect of resistance training as a source of injury. And so for years, the focus was always, oh gosh, what will happen if a child is involved in resistance training? But now we know there's a lot of great things that do happen, and that years of great research has confirmed that these kids can increase their strength with a low risk of injury, if, of course, it is a well-supervised program and emphasizes good technique. And I don't think that will ever change. That's always going to be a foundational, important aspect of a resistance training program for anyone. Not only in the United States, but now we're seeing this more global concern about the muscular fitness of our youth and where it stands. And that strength, then because of that, we see that it is absolutely necessary, not only for athletes, but also for non-athletes as well. We're seeing the importance of that foundational strength for overall physical literacy. And we're getting a much better understanding now of concepts such as integrated neuromuscular training and resistance training skill competency, as well as training age. So the perspective now is really shifting more towards what will happen if a child is not involved in resistance training. Yes, there is a need for improving the strength reserves and reducing strength deficits in our youth. I think it's important because right now we see there's a lot of deficit, and we don't want to just build up to the level of where it should be, but let's build up higher and get some strength reserves that will then allow kids some grace to have some room so that hopefully their injuries will be reduced, and that their strength reserves will be something that carries through them into their adult life. We've really now developed a very positive mindset away from the concern of injuries due to resistance training to a concern of injuries associated with a lack of adequate strength to handle the demands of some of the activities in sports. We know through years of research that kids can gain strength with a low risk of injury in well-supervised, technique-driven programs. And that usually requires a minimum of 8 weeks and is optimal between 2 to 3 times a week for the best results. Yes, there are multiple ways to gain strength other than just going and lifting a dumbbell or a barbell. The cool thing about kids and gaining strength is how it occurs. Strength gains actually occur due to an increase in neuromuscular recruitment. So for instance, if I pick up an ink pen, I'm going to recruit a certain number of muscle fibers to be able to lift up that ink pen. But if I'm going to lift a 25-pound dumbbell, I'm going to recruit many more fibers in order to do that so that my muscle can actually handle that. So since kids do not have the testosterone or the estrogen hormones of puberty, they will not get muscle hypertrophy. And so the strength gains that occur really occur not due to testosterone, but due to increased neuromuscular recruitment. And then when we get into the aspect of detraining, we're still learning. It is not as clear-cut in youth as it is in the adult population. We've learned now so much more clarity around the idea of the 1 rep max, which again used to be something that we were very nervous about and very scared about as a way to assess strength in a child. But now we know that through good research, it is a great way to assess strength. It's very helpful in determining appropriate training intensity, where are they starting from so that they can be guided appropriately. And then also evaluate the effectiveness of a resistance training program that they have already been involved in. It has been shown to be a valid and reliable measure of strength and power in children and adolescents. But I think it's also great to know that there are still alternative measures such as hand grip and long jump and vertical jump that correlate very well to the 1 rep max. So if there is still someone that is hesitant, there are other ways to get this type of correlation. We've learned that there's a lot of health benefits associated with resistance training programs. And of course, that's basically another whole talk in and of itself, but there are improvements in cardiovascular fitness. And some of these programs that aren't just going and lifting some weights, but are now involving so many different aspects of being able to do higher repetitions with lower weights and do other dynamic things such as plyometrics. And so a lot of times there are improvements in cardiovascular fitness as well, changes in body composition, improvements in bone density and blood lipids, as well as insulin sensitivity in the overweight population, as well as resistance to injury and improvements in mental health. When we get a deeper dive into that overweight category, it does provide a great option for engaging kids that are overweight or obese. They can actually start to make some gains quickly, which gives them encouragement. It also helps them avoid impact activities instead of just going and jogging. It can help with metabolic rate as their muscle weight improves. And then it also helps develop motor skills and physical literacy, which in many cases, these children have not really developed very far. So this can afford this population some great benefit as well. What about performance benefits? We've seen improvements in motor skills, speed and power, reducing injury, as well as using resistance training and injury rehabilitation. Improvement in such performance measures that have been seen, such as like vertical jump or sprint times, are very encouraging and great, but translating those into the actual performance benefit on a field or a court can be a little bit more challenging since there's so many other variables that come into play. The concept of prehabilitation uses increased strength to actually reduce the risk of injury that's associated with a lack of strength and the muscle imbalances that we commonly see in many overuse injuries. The greater use in injury prevention programs now is really important when we think about targeted programs of resistance training, such as ACL prevention programs or ankle sprain prevention programs. These will combine resistance training with certain things such as plyometrics or proprioceptive, which is basically balance control exercises. And so these kind of dynamic ways to help along with resistance training are becoming very powerful in being able to reduce ACL injuries and ankle sprains as well as other injuries. So we've seen that resistance training has a lot of great benefits. But we can't overlook the fact that if you just tack on a resistance training program on top of an already existing stressful exercise program, that it could be another source of overuse injury if it's not accounted for in the overall training volume and intensity. So it is very important that it is counted as all the other aspects of their training, so that they can really compensate and recover and have enough time to regain their hydration and their rest and their nutrition in order to not have resistance training be another source of injury. As usual, the AAP and previous statements do recommend 1 to 2 days of rest per week from competitive athletics or sport-specific training and practice. Certainly they can go walk or go for a bike ride or something of that nature and do some cross-training, but we want them to really be able to have a relative rest so that they are not doing intense type of activities. We've learned that there are medical conditions, of course, that need to be addressed prior to a start of a resistance program, such as poorly controlled hypertension or uncontrolled seizure disorders. And that there are medical conditions that may actually disqualify a child from a resistance program participation, such as hypertrophic cardiomyopathy, pulmonary hypertension, and Marfan syndrome. We've learned a lot that has been able to help us dispel and refute a lot of the myths that are out there that have developed over many years. And one of those that we already touched on was the inability to gain strength prior to puberty. Basically, if there's no testosterone, then they can't get stronger. Well, we know that's not true because they're able to recruit more neuromuscular fiber in their strength training so that they are able to gain more strength without testosterone. And then another one, getting muscle bound as a child. We know better because without that testosterone, they don't get hypertrophy that will cause them to be muscle bound. So that's not a concern. Increased strength reduces aerobic performance. Again, we've seen that it can actually complement an aerobic strengthening program. And in a lot of these kids that are in more endurance type sports, if they're doing endurance type resistance training with higher repetitions and lower weights, certainly it can improve and enhance an overall aerobic performance rather than to reduce it. Stunting a child's growth. Certainly we know after years of research that there's no damage to growth plates and it does not hinder a child's growth, especially as long as they're getting good rest and hydration and nutrition in order to compensate for all other calories that they are expending both to grow and to exercise. The concept that children are stronger now just because we're in 2021 certainly is not true, because we're seeing now, like I said, those research studies across the world that show that these children overall have a decrease in muscular fitness. And then the myth that 1 rep max testing is unsafe, again, has been dispelled, and now there are also good alternatives that can be used as well. Yes, maintaining activity and physical literacy is challenging in an era of being sedentary. With more technology and social media time combined with an overall decrease in muscular strength across different nations, of course, there is a need for improving our youth strength overall. There's a wonderful concept that really, I think, is just a great foundation of a lot of good benefits to resistance training program when we start talking about integrative neuromuscular training that goes beyond just simply lifting a weight and really improves muscular fitness, motor skill development, and performance, while also decreasing sports injury risk. Integrative neuromuscular training uses many forms of training, including resistance work, dynamic stability, core exercises, as well as plyometric and agility training. So here's one example of that incorporates a few things all at once, and that's why they call it integrative neuromuscular training. This child is certainly doing resistance training with the small dumbbells in his hand. He's also working his core with great low back and abdominal control and gluteal strength, but then he's also having to maintain his proprioceptive or balance control while on this BOSU ball. So it's really very important for him to be able to incorporate all this to really give better neuromuscular control and part of his ability to improve his overall body strength and performance rather than just being stronger in his shoulders because he's lifting a dumbbell. We're also applying the concept of resistance training skills competency. It's a great way for us to be able to include the quantity of weight lifted as well as the quality of the lifting movements and the emotional maturity of the child. And so as their competency in resistance training skills improve, the skills requiring higher technical ability and higher loads can then be gradually incorporated. So if you look at this picture on the right, the young girl is having trouble not only with the quantity of weight lifted in that right hand, but the quality of how she's doing that movement. Her arm is not bent as well, it's rotated. Clearly she's had to curl her wrist up to try to gain flexion of that elbow. So she is already trying to do something that is beyond where she is with her competency in these resistance training skills. The young boy next to her is doing a better job, so he'll be able to advance sooner than she will in this particular case. And then we're also applying the concept of training age, which really focuses more on the cumulative time spent in formalized training. So if we take resistance training skill competency with training age, it then allows a more developmentally appropriate progressive training rather than just solely relying on chronological age alone. I've had so many people ask me over the years, well, at what age can my child start resistance training? And thank goodness we've never really had a firm answer on that, because it's just too difficult based on this concept of training age. So for instance, if you have a 10-year-old girl, she may have already had a few years of appropriate training in programs of resistance training, so she may have a training age of 3. Whereas a 14-year-old boy may be entering in his first program and be starting out with a resistance training age of 0. So you can see how that then helps us develop programs in a much more appropriate way for a child rather than just relying on their chronological age. We learned that gains in strength can occur through many different methods. Certainly body weight, exercises, dumbbells, resistance bands, medicine balls, child-sized machines, and those are just to list a few. But again, it's not just going and lifting a dumbbell or a barbell. Now, there is the competitive sport of weightlifting, the clean and jerk, the snatch, a lot of heavy weights, and that sport in and of itself, those small population of kids that are involved in that sport are involved in it very gradually. They're supervised like a hawk. It's a really unique population. However, what we've learned is that incorporating these weightlifting movements can be safely incorporated into a technique-driven program. Again, very gradual, and it's a way to then also incorporate that integrative neuromuscular training. So just in this picture, you see this child also, when he gets down into that position of the squat while holding up this dowel rod, he's not having a lot of resistance, but he's doing some strengthening. He's also improving his core strength, his dynamic balance control as he goes down into that squat quickly. And we can also see here, if you look very closely, his left knee is up higher. His left foot is more externally rotated than his right. So even in his case, there are some fine nuances and changes that can be made that will then eventually improve his competency in these skills so that he can then progress in a much more appropriate and safe way. So ultimately then, where are we headed? We have come a long way. We have learned so much, and things continue to evolve and change. And that's why there's been such a drastic change in the clinical report from 2020 from the previous statement in 2008. We are headed, where are we headed? We are about emphasizing resistance training as a part of a multifaceted approach to physical literacy, exercise, strength building, fitness, skill development, performance, and lifelong activity for both athletes and non-athletes. We're about combining resistance training with aerobic training, adequate rest, proper hydration, proper nutrition for overall general health and fitness. Again, both for athletes and non-athletes. About improving the current strength deficit in the youth population while producing a strength reserve for movement skill development, sports performance, and injury reduction. We're about supporting the reality that resistance training may involve many various techniques beyond simply lifting weights. and we are understanding the need for programs to include integrative neuromuscular training and utilize resistance training skills competency as well as training age for the best success that we can have for these children in these programs. We're about stressing the requirements of proper technique and qualified supervision for both safe and effective resistance training programs. And we're also finally encouraging parents and coaches to see the use of resistance training as less of a risk and more of a benefit for sports and health. So I really encourage you to support a very positive approach to resistance training for both athletic and non-athletic patients. Thank you so very, very much.